Hi, I'm Dr. Duke, and this is Run Smart New York. Today I'm with Caitlin, local triathlete. She works with Empire Tri, and she's going to be helping me out. This is part one of a mini-series on IT band syndrome. So first, what is IT band syndrome anyway? It's a catch-all phrase that means that there's problems with the side of your hip and down to your knee. And when it gets short and tight, it wreaks havoc on running form, on cycling. It causes pain around the knee. It gives bursitis. It's just a terrible thing to have. Now the thing is, most doctors and therapists think that they can stretch it. And the deal is, you can't stretch it. Show what most people do, Caitlin. I mean, the fact is, the IT band adheres to almost everything. It adheres to your quads. It adheres to your hips. And if you missed it, I need you to go back and see it because I did two really great presentations on how to use foam rollers and massage balls to release the IT band from both the hips and the glutes and the hamstrings. So if you didn't catch it, go back and check it out. Now most people do this. They like sit on a foam roller of their choice and they're like squishing, mushing, mashing, and compressing the IT band. It does absolutely nothing. So Caitlin, do me a favor. Get out of this posture. This is not what I want people to do. First, I want to talk about what really causes IT band syndrome. So, turn and face this direction. IT band syndrome, like I said, is a problem from the outer part of your hip all the way down to the bottom part of your knee. Now, when it gets short and tight and adhesive to the quads and the hamstrings, it pulls on the kneecap and it pulls it out of alignment. And people are like, why did that happen? What's wrong with me? The thing is, sometimes there are things that are wrong with you. Your ankle could collapse in, just like hers is doing inside here. That's called hyperpronation. And you know what? You can't correct that. You could try to, but usually if you're built like that, you're just more prone to getting IT band syndrome. Doesn't mean you're gunning at it. The other thing that happens, knock your knees together a little bit. Knock knees. Or stand up straight, put your ankles together. Let's see what she looks like. She's pretty good, but you can see that the knees start coming in together. Most IT band problems happen in women because of their hourglass shape where the waist comes in, the hips come out, and then the knees not together. And then that just puts additional strain on the outer part of that IT band. Lastly, a weakness to the glute medius. Turn sideways for everybody. Glute medius is your outer hip. It's the outer part of your glutes, and most people think that their glutes are strong just from running, but you have to do strength training in order to kind of make sure that that glute medius fires, because if that glute medius gets weak, guess what? Other muscles have to work instead. So when the glute medius is weak, the tensor fasciolata, which is, by the way, the anchor point of your IT band, starts to take up the slack. So when this glute medius is weak, TFL gets short and tight, and next thing you know, boom, it starts pulling on the IT band. So today, let's focus on mobility. Now most people, when they think about mobility, they think about yoga. And yoga is not mobility. Yoga is like stretching out your ligaments and getting like a really loose joint capsule. This is not something that I want you to do to prepare yourself for running. This is exactly opposite what you need. Hey, you gotta stop that. So what I'm gonna show you are some mobility movements that lubricate the joints, and you hold it for like 5 or 10 seconds. It wakes up some of the connective tissue. These are some really good things to start getting your body prepped in order to run or cycle or swim. All right, first, get into a nice lunge. Big lunge. That way we're stretching out the hip flexors on one leg. And now, focus on the ankle. Keep your ankle super steady on the ground. Take this hand and just push your leg out, but keep your ankle there. Now we're working on mobility of the ankle and stability, and you're probably feeling it where? Up in that hip area? Thank you. We're getting around the pelvis. We're loosening up the adductors, and we're keeping that ankle nice and steady. Now, get both hands down and try a little spinal rotation. Do it an easy way first. Very nice. And you don't hold it for too long. You just kind of hold it just enough and really rotate so you feel, again, the pressure in the hips and around the groin and spinal rotation. Now put your arm down and now rotate the other way. That's it. That's a little harder, isn't it? And you kind of follow your gaze up to the sky. And now, come out of this. Again, this is 5 to 10 seconds. These are not yoga poses that I want you to hold for like 1 or 2 minutes. Now, let's get on your back for me. See, the IT band, it attaches to your pelvis, so we have to do some mobility work to limber up the pelvis. Put your arms out to the side, bring one leg straight up in the air, and now twist it all the way over and turn your head. And now come all the way back. We don't want to hold it for too long. And now take the other leg, same thing. You may feel a pop or a click inside that lower back. That's a good thing. That's carbon, oxygen, nitrogen being released from the joints. It's getting the pelvis a little more lubricated. So when you go out to cycle or to run, you're going to feel a little more limber. Now bend both your legs all the way up to here. And again, just drop them to the side. And then drop it to the other side. Keep on going back and forth. Simple hip drops will do something very similar. But you want to keep on changing the ranges of motion in order to dynamically challenge the muscles around the pelvis and the hip and the IT band. Then put your ankles on the floor, take one ankle, put it on top of here, and now pull this all the way over to the side, all the way down. This is going to get the quadratus lumborum, the tensa fasciae lata, the IT band, but it's really meant to, here, come back the other direction. You don't want to hold it too long. It's meant to get a release to the sacroiliac joint. That's the joint between the glutes. That's your pelvis. And you want that rotation when you run. Come on back. These are not stretches. These are movements. Come on, Caitlin. Try it again. Pull it all the way over to the side. Great. Come on back. And try it to the other side. Excellent. And come on back. All right, listen. Join me for part 2 of IT band syndrome when I go over strength exercises that you do to stabilize the area where you don't have to use weights. I'm Dr. Duke, and this is Run Smart, New York.